And so when you go into the classifications for this, how do you classify these intertrochanteric femur fractures?
I think I try to make classification systems as simple as possible. And I know
Perfect.
there are multiple classification systems for these
Yeah.
intertroch fractures, and they all, your picture breaks it down perfectly. All of these classifications, you can simplify them by trying to identify the more stable fracture patterns and the more unstable fracture patterns. And there are certain qualities, you've got your list in here of the unstable ones that make them less stable. And I think the key is really identifying the unstable ones and realizing they're going to be a little bit harder to repair, and that you're probably going to you're going to have to be a little more specific about your fixation methods. So all the things you have here, really that comminution of the posterior medial calcar is a huge marker of instability. Reverse obliquity patterns, the displaced greater trochanter, which can sometimes go along with the reverse obliquity pattern, and then the subtroch extension. You really hit all the high points. That classic teaching of when you're just trying to choose your fixation strategy if the lateral wall is not intact, you may need a certain fixation strategy, and then if the posterior medial calcar is not intact, um,
Right.
dealing with a less stable fracture.
Yeah. And I've seen some, just watching some YouTube videos and just, prepping for this podcast episode. There was an AO talk where they kind of talked about some characteristics or some fracture patterns to be able to at least just kind of recognize and know that this may be a more unstable type of a fracture. And, these were things like where you had the proximal fragment was going posteriorly, or when the proximal fragment is inside the medullary canal, or you have
Mhm.
3 or 4 part fractures. Is this something that you go by as well, or that you've noted that you definitely will likely need to open or reduce these fractures, and they may not just be easy to get a closed reduction?
I have to say, I've never seen this particular classification pattern, but I like it.
Ah.
The banana classification, it reminds me of the AO video of the tension band where the guy, they use the intact banana and then he bites into the banana.
Yeah.
Uh, I think it's whatever classification system you use. It's again trying to find that dividing line between the stable and the unstable patterns. And the stable patterns share, they have the intact calcar, the intact lateral wall. The unstable patterns are deficient in those areas or
Right.
have more distal extension. And so, you start to get a sense of it. Your eye becomes more attuned to looking at what's stable and what's unstable.